Good afternoon. I want to update you on an incident that took place yesterday at the Lansing Correctional Facility. Yesterday around 3 p.m. there was a disturbance in cell house C at the correctional facility. On return from their shower time, a handful of inmates caused a disturbance and barricaded themselves in their unit. Per Kansas Department of Corrections protocols, correctional officers vacated the area to allow leadership to bring together the appropriate personnel to handle the situation. At around 11 p.m., KDHE Special Operations Response teams from Lansing and Topeka entered the cell block and secured it. After searching inmates and securing the scene, the all clear was given around 2 a.m. All inmates are secured and accounted for. There were 2 minor medical incidents. 1 inmate required stitches for a cut and another inhaled gas that was used when the SORT teams entered the facility. No staff were injured. Department of Corrections Secretary Jeff Samuda is here to give more details and answer questions about what happened and how our team responded. But first, I want to be very clear. The goal of my administration is to be transparent about incidents like this one. We believe it's in the best interest of public safety to let people know when these things happen and how they were handled. This is the first time during our administration that an incident of this magnitude has occurred. While this was a first for my administration, it was not a first for the Department of Corrections. While a review of the disturbance is underway, it appears that officers followed KDHE protocols and that ultimately ensured that injuries were minor and that there was no loss of life. We've launched an investigation into what took place and what can be done moving forward to ensure that this doesn't happen again. But rest assured, my administration will complete that work, hold those responsible for the disturbance to account, and put in place any additional steps that are necessary to ensure that safety and order is maintained. We will learn from this. I want to thank the officers and Kansas Department of Corrections leadership who brought this incident to an end swiftly and professionally. Safety in our correctional facilities is important not only to those incarcerated, but also to our employees and officers who work at our facilities. Lastly, I want to address inmate health care. Inmates and staff are concerned about the level of care inmates have been receiving from the corrections medical provider, Cargill. I understand their frustrations. In fact, I share them. Since I came into office, we've worked with Cargill to identify shortcomings within the prison's medical system and put in place corrective action when necessary. We have not hesitated to hold Cargill, like all vendors, accountable. In fact, Secretary Samuda was in contact with their CEO just yesterday to discuss some of the problems that we have recently identified. But this has been an ongoing issue. Therefore, I have directed my Chief of Staff to send a letter to the CEO elevating these concerns. And with that, I'll hand it over to Secretary of Corrections, Jeff Samuda. I've asked him to provide an update on the department's response to the COVID-19 pandemic and steps we have taken to keep those who are incarcerated and our staff safe. Secretary Samuda.
Thank you, Governor. Good afternoon. In late February and early March, the KDHE began revising our standing pandemic plan to adjust in response to the COVID-19 virus. We began educating staff and offenders as to good practices and safe precautions to protect them from the virus. In mid-March, we suspended visitation for all visitors, tour groups, volunteers, and mentors into our facilities. We began extra cleaning processes in high-traffic areas and provided additional cleaning supplies to keep areas sanitized. Mid-March, we implemented a passive screening process for all those entering the facility and exiting. We limited transfers between facilities to those limited only for necessary for safety purposes. Late March, we initiated an active screening process at our entrance and exit points of our facilities for both staff and offenders. That same week, we eliminated a $2 copay for medical services. We wanted to ensure that there was not a barrier to care, and for those coming forward with symptoms of the virus, that has been removed. Beginning April 3rd, we implemented an intake isolation unit for our male population coming in from county at the former Larned Juvenile Facility. Inmates coming into the system from county jail will stay at the Larned facility for a minimum of 14 days till we're ensured that they are not contaminated or exhibiting symptoms of the virus, and then they'll proceed into our normal process. These are not people who have tested positive. They are people simply coming in from county, and we believe that's another barrier that ensures safety. Kansas Correctional Industries is producing surgical type masks made of cloth for use by our inmate population and our staff. Those, we've begun distributing those. That started yesterday at our Lansing facility and will progress through all of our correctional work units. Social distancing in our prisons is difficult. However, we've taken steps to try to control movements, restrict people to units wherever necessary and appropriate, and make sure that when movement occurs, to the greatest extent possible, it's done in cohorts. Today, we have 12 positive cases in our offender population of the COVID virus. They are in a quarantine unit. We have 7 additional offenders in that unit that are under quarantine for observation. And we have 16 staff who have tested positive for the virus. All of those individuals are located, assigned to the Lansing Correctional Facility. The isolation or quarantine unit is also located at Lansing in the new reconstructed facility. Kansas Department of Health and Environment has assigned staff, embedded them in our organization to assist us in the management of our population, our staff, and thwarting the virus. We appreciate their efforts and will continue to work with them closely to monitor what's going on and take steps to mitigate introduction of the virus any further. This opportunity, I'd like to take the opportunity to introduce Dr. Lee Norman, who is the Secretary for Kansas Department of Health and Environment.
Thank you. Thank you, Secretary. Thank you, Governor. Brief update today. The total number of positive cases we have in the state of Kansas is 1,166, which is an increase in 60 cases since yesterday, with 10,248 negative test results. We have increased to 50 deaths, which is an increase of 8 since yesterday. Wednesday, 2 days ago, was the highest increase in deaths in Kansas at 11. We are currently working throughout the state with 17 outbreaks, the largest ones being in Coffee County, Wyandotte, and Johnson County. In regards to religious gatherings, there's been 1 additional outbreak related to a gathering and 1 additional death from a Wyandotte County religious gathering, so a total of 3 deaths. The husband-wife couple have commented about in Montgomery County and now an additional Kansan. There have been 2 outbreaks in private companies. I wanted to talk briefly on masks. We've been talking a lot about masks lately. That KDHE issues homemade mask guidance, both on our website and a video on social media as well. The homemade masks are meant to be worn briefly, not for long periods of time, but briefly when in those instances when you cannot maintain a social distance of 6 feet or greater for 10 minutes or longer. This primarily occurs when you leave your house going out in public when social distancing is hard. Again, you can go outside and as long as you're able to maintain social distance, you don't need to wear a mask. But in those instances where it's not practical, for example, going into essential businesses like groceries or pharmacy, visiting healthcare providers, or on public transportation, when there's going to be more than 10 people and you're going to be in closer approximation, that's when you wear a mask. The Masks don't eliminate the spread. You wear a mask to protect that person, and that person wears a mask to protect me. I want to show you, because I promised to do this, how to put on a mask. It may not seem like rocket science, but there are a couple points that are important to know. The mask, you do not touch the outside surface of the mask. The mask is a filter. So it's important when you put it on to not have the hand on the front part of it, okay? It's fine to do if it's fresh out of the laundry, but once you've worn it, think of it as something that's adherent. The virus is adherent. So the mask goes here, and then it is tied up at the top of the head. And the reason is if you tie it straight back, it'll continue to slide down. So once you have it tied up on the top, then you tie it behind here to hold it firmly. You notice during this process, I didn't touch my face at all. Then when it's time to remove the mask, you untie it, fold it down, and put it away. So think of this as contaminated on one side and relatively cleaner on the other. The mask should be not worn for long periods of time. I mentioned that, really as short as is necessary, and it should be laundered at least daily. I wanted to give you one brief science lecture just because I love that stuff. But it's something really important, and there's some new information coming out, and I think that you'll find it beyond just interesting, really important. The Los Alamos National Laboratories has been conducting a study for the CDC. Remember, we've talked before about the R sub naught, the infectivity factor, that for every one person that catches the coronavirus, it was thought to be around 2 or 3 people. What they're finding now through their studies, that it's probably up more towards about 6, which is in keeping with how highly infectious we're finding this virus to be. The R sub naught with social distancing is thought to be about 1.4. So that's a third. It reduces it down to a third of its infectivity, which is dramatic, and that is simply from social distancing, which should serve as a huge motivator for social distancing. It's really the first time in modern history where this has even been studied, because mostly we have vaccines. So you can take measles, for example. Measles is probably the most infectious illness that there is, with an R sub naught of 14, 16, 18, something like that. But the vaccine takes it down to below 1. So when the R sub naught drops down below 1, then it's no longer passed from person to person, and it fizzles out. The outbreak goes away, essentially. Good news. On the unicast, which I check regularly, the Kansans are taking this message seriously. As a state now, we're ranked at about a B-. The United States as a whole is ranked at about a B. We have quite a number of counties that have A rankings. And again, this is total amount of travel restricted voluntarily, to essential travel and unessential travel. There are still a lot of counties with F grades. Some of the larger counties still are kind of C, C-. So we still have some distance to go. But I think this minor science lesson of you can reduce from 5.7 infectivity factor to 1.4, and it's tying into the restricted travel we're doing. Could be a home run, and we cannot blink. We have to keep pushing on this, and especially in an upcoming weekend, that it would be one where people would tend to gather a lot. So take it very seriously. End of remarks.
Questions?
Secretary Zulu, can you tell us, what triggered the disturbance yesterday, and did it have any relation at all to the outbreak?
You know, we don't know yet exactly what triggered the outbreak yesterday. We have staff interviewing our offender population, debriefing staff, and we should know what that is in the future, but I don't know today.
Did that happen where the quarantined inmates were?
It was not in the unit or in the building where the quarantine unit is. It was at the Lansing Correctional Facility, and in the existing Lansing Correctional Facility, and in the reconstructed new facility is where the quarantine unit is, adjacent to the current facility.
The officers that came there to help, from Topeka, whatever, will they be quarantined for 14 days now, when, at this point, knowing that they went into an area where there could have very well been COVID?
You know, the unit that they went into, we didn't have any offenders exhibiting symptoms of the virus. We don't have reason to believe that they were exposed or infected. We'll work with Kansas Department of Health and Environment to determine what to do with those staff, but I don't believe at this point we have any intention of limiting them with a quarantine.
Secretary, inmates are saying, and I mean, you mentioned social distancing is very difficult in prisons, obviously, and inmates are saying that it's inadequate. So, you know, we've heard that they're still sleeping, eating, moving, you know, in close quarters with hundreds of people close to each other. Is that true? I mean, what is the actual situation with the proximity of what number of people are close to each other?
Well, if you come and visit some of our housing units, and I'll use a dormitory style setting or maybe a two-man person cell, our population is in close proximity to each other, and there's just not a lot you can do when it comes to the sleeping quarters to do much about that in some instances. What we can do is try to keep them in groups so they're together in cohorts, and so they're not intermixing in other parts of the institution. I think we've put steps in place for that, and then try to keep them limited in their movements about the facility, try to keep them, where there's a cross-pollination, if you will, try to keep them confined to the unit as much as possible.
The cohorts that you mentioned, do you mean for eating? Do you mean for, you know, and what size are these cohorts?
That's what I mean. As much as possible, the eating, the other movements together. I think we've got that in place at most of our facilities today. Would you repeat the second part of your question?
What size are these cohorts that
Well,
you're describing?
yeah, it would depend on the living unit or the tier. So the living unit that we had the issue with yesterday, I think had a capacity of about 260, I believe that. We had 169 people living in there yesterday, and so it could be that. It could be a little bit smaller unit. It varies throughout the organization.
Did you see the YouTube video that was posted from an inmate? And in the video, someone mentions that it has they're rioting because of the coronavirus. Have you looked into that at all?
I did see a portion of that video, and that'll be part of our investigation.
Secretary Norman, earlier in the week, I think on Monday you had said 3 of the 12 clusters at that time had been church-related. You went through several numbers. How many of these clusters now stem to religious gatherings, and are any of them tied to religious gatherings that happened in kind of contravention of either state or local orders?
There's, there's 4 of those clusters that have occurred, and one has occurred since the executive order. Yes.
Could you talk a little bit more about that religious gathering you mentioned earlier, where it was, how many people were there, and why they were there?
I don't know the total number. Our investigators most certainly would, because they do contact tracings. 2 are in Sedgwick County and 2 in Wyandotte County.
Secretary Zamuda, I apologize if you already answered this, but I wanted to ask, were there any injuries reported, and what will happen to the inmates that participated in the riot?
There was one injury, a cut on one of our offenders. Another offender experienced some health issues related to being confined in the unit when we went in. Both were treated and released on site at the facility. And then again, give me the second part of your question, if you don't mind.
Inmates who participated in the riot,
Yeah,
and what
yeah.
happens?
Yeah. No injuries to our staff. Very important. I'm thankful that the injuries were both minor to our offender population and our staff. And then the inmates that were in that unit last night are in a segregation unit at the reconstructed Lansing facility today, in a lockdown unit, if you will, while we conduct the investigation to determine who needs to be held accountable, as the governor suggested.
Got the steps on plans to release some vulnerable inmates that the ACLU has been kind of pressuring. Inmates who might be close to the end of their sentence, something like that. How would that help kind of reduce something like this?
Well, certainly, if you have more room and more beds, that can ease a little bit on the overcrowding, and depending on the offender, you know, it could help us with maintaining good order and discipline and safety within the facilities. Certainly.
Governor Kelly, there's a elderly woman who tested positive for coronavirus in a Kansas City nursing home. She then went to a hospital to be treated for a broken leg, and now she's ready to be released, but she's not able to go back to that nursing home. Are you considering implementing new policies that will allow these people that need those care in nursing homes to be able to go back to them? Because right now they're not being allowed back in for testing positive for coronavirus.
I'll be honest, we have not had a conversation about that yet.
Governor Kelly, the Lawrence Journal World wants to know, will Kansas extend its stay-at-home order?
We are having conversations about that, about whether or not we'll extend the stay that I think now is in effect until April 19th. We will be addressing that issue with everyone early next week. My guess is yes, we will extend it, but we don't have the details on that right now.
Governor or perhaps Secretary Norman, what do we know about the parity of access to testing in the state in terms of, I would guess that wherever you live in the state, if you qualify for the KDHE state lab testing, you qualify for that testing. But I've heard that maybe there are some counties where hospitals or clinics are not using private labs, they're just relying on the state lab, and that means that people that don't meet those state requirements can't get testing. Is that the case? Do people have access to private lab testing across the state?
Every county, people in every county have access to testing either through commercial labs or through the state lab. You're right that we have had limitations because we just haven't had enough test kits and testing ability to test everybody that wants it, for example. And so we've been using the criteria that are posted on our website for a person under investigation. The tests, we are getting a lot more options. We're still waiting for the limiting factors of some of the testing material. I didn't mention in my prepared comments, but I will mention now that we're starting in Johnson County to do more widespread population-based testing. We'll be standing that up in Finney County within about the next 10 days to 2 weeks, something like that, because we want to get and understand what the population incidence is for positivity, either people who currently have it, they're easier to figure out, obviously, or people who have had it that may not have been diagnosed. And the reason is, and I'm going to expand on that just a little bit, if we know, for example, that there's, and it's estimated to be between a 5 to 10% population of people that at any moment of time in an outbreak that could be preclinical and perhaps infectious, incubating and infectious, or even ill. And imagine a gathering of 50 people. To have 5 to 10 people that are possibly shedding the virus. That really shows in the light when you go into a room or an area with 50 people that 5 to 10 people there have this or are shedding this virus, really, that's what we want to answer through the community testing.
But you mentioned people who have had the disease as well, so are you doing serological
We will.
tests? You will be doing that?
Yeah.
And do they specifically test for this one virus? Because there's been concern about cross
It would be exclusively for the COVID-19 virus. And it's it's two kinds of immune globulins. One would tell you if the infection has happened just quite recently, and one would be more distant in time.
So it wouldn't confuse that for other coronaviruses?
No, it's distinct.
A few states have experienced outbreaks in their large food processing facilities, meat packing plants, that kind of thing. Obviously, those facilities are, I think, largely considered essential because they surround agriculture. I'm curious if you've been working proactively with these type of facilities, Tyson and the other companies that operate in the state, in terms of the specific risks that exist in these kind of large facilities.
Yeah, Jonathan, we have been. We've been in touch with both Cargill and Tyson, and both of those companies have implemented a number of procedures that will allow for safer but maintained production. For instance, I talked with the CEO of Tyson the other day, and they are having half the number of people come into the facility at any given time. So they're essentially doing 2 shifts. They're slowing the line down so they can keep folks farther apart. And then they're also constructing shields, much like people have been doing in the grocery stores, so that there's less passage of germs between people. So, yeah, they are doing that. And also they're working to ensure that people have the PPE that they need to be safe.
Could you go into a little bit on your lawsuit and why you think the Supreme Court will side with you? Like what reasoning behind that will support your case?
Well, they're over there doing that right now. I think we felt very strongly that the LCC really is not authorized to act in that capacity as the total legislature, that any revocation of an executive order would have to take place by the entire legislature acting, not a 7-member panel.
One more question?
Do we have any more information about how things will work for the uninsured? The Trump administration has talked about using part of the CARES Act funding to pay, not just for, at this point, not just for COVID testing, but also potentially treatment of the uninsured. But will Kansas be involved at the state level in any way in making that happen? Do you know anything about how that's going to happen?
I think it's going to happen through our Medicaid program. I think that's how the structure has been set up, so that people who have no insurance, they're not on Medicaid and they don't have their own commercial insurance, either through the exchange or through private, through their company, then we'll be able to provide the COVID testing and the COVID treatment, and we'll be able to bill through our Medicaid program for that.